Great. I'm Dr. Enoch Choi. I'm so glad to be here. I'm an advisor to Medicine 2.0. I'm really excited to be sharing with you this morning. I'm actually a primary care provider. One of my providers, Susan Anderson, is here. She stopped on one of her whirlwind around-the-world visits to stop by and join us. She works with me over in the urgent care, where I work full-time across the street. My background is, before practicing, I've been a product manager at Medicalogic in personal health records and in EHRs. And 12 years ago, we were able to go public and sold the company to GE. And since then, I've been practicing full-time and done a lot of consulting for venture capitalists, a lot of startups, and also for the government with my role as a standing member of an NIH ARC review grant committee. I'm here today to try and share with you about the virtuous cycle of social media. I think a lot different from most of the physicians that you'll meet around the country, and like the ones that you heard recently from Boston that don't follow their patients' blogs. Unlike that, I'm actually very immersed in my patients' blogs and in the community, and I wanted to share how that can really make a big difference. I wanted to quote one of my friends who I was hanging out with last night, John Sharp, who I've known for a dozen years since meeting him at AMIA. He just tweeted 16 minutes ago that Med 2.0 is about blurring the lines between academics, entrepreneurs, e-patients to push the envelope of healthcare innovation. I don't know, John, you're here somewhere. People have been trying to say hello. Okay, went to the restroom. I wanted to just share how I want to be able to share how physicians don't have to be afraid of engaging in social media. The vast majority of us are. And I want to share about the serendipity of how engaging in social media can make a huge difference. One of the people here in the room, Brian Vartabedian, I wanted to give a shout out to. He's here. There he is. Okay. And he was one of the panelists here at the conference. We met at Blog World, and I'm coming back to Blog World as a panelist. I wanted to share, these are the kind of connections that we make at different places, different connections that can lead to much richer interactions. And this is an example of just a group of amazing people that I've met. Just last night after hanging out with John Sharp, and I was also just having drinks, and I was checking out, and one of my patients recognized me, someone who I'd had interactions with because she had supported some of my disaster medical relief work, and just because, actually I actually never met her. She's a patient because I cross-cover for my partners, and some of my partners had seen her before. But I'd never met her, and she just stopped me while I was checking out with, and I had a chance to sit with her and sit with her family and chat more. This is an example of the kind of serendipitous happenings that happen when people have a chance to see you in real life after following you on the web. That happened because there were a number of conversations that I participated online with them, both on public venues like Facebook and also private venues. This is a person who I participated with because I have young children, and there's a local group of about 5,000 families on something called the Palatamilla Park Parents Club. And they're very active on a private Yahoo group. So instead of the public web, it was a place where on the private Yahoo group, I'd had a chance to maintain a conversation with these people, sharing with them things like about our flu clinics at our clinic and different things that people really appreciate hearing about. These conversations led to interactions in real life. This person that I just serendipitously met again last night is someone who supported my disaster medical relief work in Haiti and now Japan. Many of the schools locally have been doing that, and they've been providing lots of feedback. Feedback because the children in their schools have been really excited to support this kind of medical work because they feel like they have a real connection with someone. I go to their schools, I share with them about the kind of work we're able to go and volunteer overseas, and they feel like they have an integral involvement in this work that we do, and they make it possible. These relationships continue. The relationships that develop and become more and more rich, the more times you get a chance to touch that person online and in person. And end up in wonderful stories that they can share with others and tell other people about the work you're doing. And I wanted to share how physicians should not be afraid of participating online, because we're people and we want to share as well. The way to make it really safe to share online is to make this about public information. Don't make it about patient care. It's not individual patients that we can care for online. There are HIPAA-compliant, secure ways of doing so. We have a very popular web portal and iPhone app that out of our 1 million patients that we cover, Palo Alto Medical Foundation covers on the peninsula, a third of them participate with us in these private interactions, providing actual care. What I'm talking about is maintaining a public presence on the internet. The way you can do that on Facebook is by a Facebook page, which is by definition public. Recently, they've enabled a way for your private Facebook profiles that you usually just share with your family and friends, a way for people to subscribe to you. And except for the more sophisticated physicians, I wouldn't suggest it, but now I've actually transitioned to be able to allow people to subscribe to public things that I share on my own individual profile. But overall, to make it simple, your private profile, it's good to keep your private profile private and your public Facebook page a place that you can promote the public health and other interests that you have. LinkedIn is a great way to interact with people on a more business side, and it leads to be able to provide consulting. MedHelp is a place that I answer questions online where patients, I'll answer one question, and because it's so detailed about the stage of illness and the kind of treatments that I'm providing, hundreds of comments will show up, and a rich dialogue will ensue without my intervention. Again, this is not about providing healthcare online. You can do that privately and in technologies that allow that. But what's important for providers to do, if you're part of a large group, I have 1,000 partners, even if you're part of a small group, it's important that your involvement in social media as a provider fit your practice culture. Do it on your own time. Don't include any personal health information, and anonymize everything. Change, if you want to tell stories, try to change genders, change dates, change situations. Try and change everything, because you really don't want the patients to think that you've disclosed their personal information. Watch your humor. Sometimes some of your partners may not appreciate the kind of humor you have. Ensure that you express your own personal opinion, and don't make it somehow having your group endorsing this work that you're doing online. And you want to remove references to your organization when you do political activities online, soliciting donations. These kind of things make it really clear that it's your private information. Videos that I've provided online in terms of patient education have been really popular. I treat a lot of cellulitis, and one of my cellulitis patient education links has had many tens of thousands of views, because there's just so few physicians that are willing to get up there and just share what we think you should do when you have an infection like that. Facebook more and more is seemingly more popular as time goes on, just because of the network effects of how so many people on that platform. Blogs are a really amazingly important way for many of the local patients to express themselves, and I've followed many of them. I see them transitioning though now, less blogging and more short-form writing as status updates and notes on Facebook. And some of these popular local writers have even been picked up by the local newspapers. We have local websites that promote their writing, and AOL has Patch, which is a local blog also.